Hi, welcome to MD Anderson. I want to share with you some exciting new data we've developed in our laboratory. I'm Dr. Lawrence Cooper, and with me today is Dr. Colleen O'Connor. She's an outstanding scientist and really has some excellent data. So Colleen, I understand you've been working on T cells and making a new therapy for dogs. Can you tell us about it?
Yeah, so what we've been doing in the lab is using the pet dog as a model for human cancers. And right now we're focusing on B-cell lymphoma.
Dogs get B-cell lymphoma?
Yes, it's actually the #1 type of cancer that dogs actually get. Over 25% of dogs in the nation actually end up with B-cell lymphoma.
So my dogs might get B-cell lymphoma?
Yes, it's very true, and it's definitely it's prevalent in several different breeds actually too, like golden retrievers.
And is this type of cancer curable in the dogs?
Actually, no, it's not. The 2-year survival rate is actually less than 20% right now, so it's incurable.
Oh my goodness. So 8 of 10 dogs die of their lymphoma.
And most within the first year, actually.
And that's despite therapy?
And that's despite the same kind of chemotherapies that we give humans, too.
Chemotherapy?
Chemotherapy, yes.
Oh. So what have you been doing to solve this problem?
So what we've been doing is that we've been using dog T cells, where we've been growing them up into large numbers. And then we've been infusing them back into dogs after they've had chemotherapy.
So dog T cells, they're their own immune system?
Yes, it's their exact own immune system. There's nothing weird about them. We just grow them up and we just put them right back into this dog.
And you've been doing this in people's pet dogs?
Yes, people's pet dogs. They can enroll in our trials through Texas A&M Veterinary Hospital and can join this, and we give them their T cells. We grow them up over about 6 weeks, and then they're ready for infusion.
Wow. So I'm sure out there you want to know, does this work? All right, Colleen, tell us.
So,
if you put back, let's just get this right. You're taking blood from the dog, you're manufacturing T cells, you're putting those T cells back into somebody's dog, and what happens?
Well, surprisingly and so excitingly, that we have seen that we can improve the tumor-free survival 4-fold increase.
Wow. So these dogs are now living as a result of having this type of T-cell therapy.
That's correct. And we've seen a significant increase in their overall survival too. So they're actually living longer with their chemotherapy and T-cell therapy rather than just chemotherapy alone.
Fantastic. Congratulations.
Thank you.
So what we're studying here is the world of comparative oncology. The ability to harness an animal, like somebody's pet dog, and do exquisite research where the owner of the dog knows exactly what's going on. There's no concerns for the safety of the dog. In other words, we're experimenting on the dog. But what we're learning is that when we put T cells into that dog can be rescued and cured. So this world of comparative oncology is a new opportunity for us because it really complements all our other studies. For decades, immunologists have studied the way the immune system has worked, but has done so in the mouse. And does the mouse really help us? Does it help us when we put human T cells into a mouse to try and understand the potency, in other words, the anti-tumor effect, or the toxicity, in other words, the problems that might occur? Does it help us when we use that mouse model? Or, with Colleen's help, should we go to the companion canine, the pet dog? Because after all, for 15,000 years, dogs and humans have coexisted. We have many of the same types of cancers. We eat the same food, or at least my dog eats the same food. We have a lot of genetic similarities. And as a result of Colleen's work, we now have the foundation to go on and study other types of immunotherapy. And Colleen, as she's so ably demonstrated, has already developed a new therapy for dogs. So thanks very much, Colleen.
Thank you.